Today, we are fortunate enough to be talking about centering pregnancy with certified nurse midwife, Vanessa Wright. Welcome, Vanessa. Thank you for joining us.
So glad to be here.
And what is centering pregnancy?
Centering pregnancy is group prenatal care where women who have the same due dates all meet together and they learn about their pregnancy together and they go through their entire pregnancy together in a group setting. And it's kind of like a childbirth education class. It's your routine prenatal care. It's wonderful.
It sounds like it builds in a really nice support structure. What is each visit like?
Each visit is 2 hours in length. It starts at the same time and ends at the same time every session. So that's wonderful that you're not sitting in the waiting room waiting for your visit to start. You're not waiting for if your provider's behind. You can start and stop at the same time. So it's really nice to get your day going and your time is valuable. So you'll come to your first prenatal group and you will come in and you will take your own blood pressures and your own weight and your own vital signs and you'll record them. That way you're in charge of your own prenatal care and recording and you know exactly what's going on with your pregnancy.
What if I don't know how to collect my own vital signs? That sounds
intimidating. We will show you.
It's
pretty easy. You just will check your weight and then you'll do your blood pressure and she'll show you how to do it and pushing the button and all that good stuff. Then each session has its own set topic. We'll kind of meet together 10 minutes and we'll have like an opening, a warm session, getting to know everybody. It'll change every time. And then individually you will have like 3 to 5 minutes where you'll meet with the midwife. We'll do tummy checks. You can ask any questions. Primarily the questions that you ask the provider, we will put on a whiteboard for the group to discuss because everybody pretty much has the same questions. Am I gaining too much weight too quickly? Am I feeling the baby move? Things like that we can all answer as a group. So after that, everybody gets back together and we talk about the discussion that people have and the group topics for the day. It's wonderful.
The experience of centering pregnancy sounds like it probably is very different from individual visits. What would you say are the main differences between individual prenatal visits, such as the traditional model, versus the centering pregnancy model?
I find that centering is very much like what I think midwifery, and it's a lot of education and support and kind of bonding with my patients. And in a 15-minute return OB visit, you just really don't have the time to get to know your patients as well. And you still get in all of the medical things that need to be done, just the vitals and checklists, but the actually knowing how they're doing, where they are, what their family dynamics are, where they need support, you really do get to suss that out in centering visits.
What if you have any individual questions for your provider that you don't want to discuss about with the whole group?
More intimate questions? Mm-hmm. Yes, so that will be discussed with your provider at that time or you can wait if it's kind of something that's more sensitive and more time sensitive. You can meet after the group to discuss individually.
The individual fundal height checks and heartbeats, are those done separately or how does that work?
They're done individually. So there's about 20 to 30 minutes built in while the rest of the group is talking. And so individually, I'll pull a person, say, to come to the exam room for like 3 minutes where I've already prepped the chart. I know kind of, and any questions, have you scheduled your anatomy ultrasound? Make sure that we've got these things are, individual to this patient. And then we'll do the fundal height and we'll listen to the baby's heartbeat and any questions or concerns you have. For example, our last group last month, there was a lot of weight gain questions. There were a lot of, I can't feel the baby move yet, all normal at their gestation. And then we just brought it back to the group. So nobody had any pressing questions that were sensitive or that needed any additional things. And so after everybody has had their individual time with the midwife, then we meet as a group again. From previous when I worked elsewhere doing centering pregnancy, we would have questions about a possible sexually transmitted disease testing and things like that, which I met with after, and I would say, okay, I'm going to order that for you, and I will follow up with you after the results. And so I, just like a patient in clinic, I would follow up with after when the results come in.
So that's nice. There's still that opportunity for
continuity,
care that you would like to be private, and have continuity.
Yes, and we at the very beginning we kind of sign a little thing that it is a group prenatal care, and this is a group session, and it's private and sacred, and everybody is a safe space to share information and thoughts and feelings. It's wonderful.
If I'm a patient considering centering, one of the things I might be thinking about is just wanting to make sure that I still get the personalized medical care that I need. How do you make sure that that medical care is achieved through these centering sessions?
Well, with centering, you do have that individual time, one-on-one time with your midwife. And then because you're going to have the same midwife or provider throughout the rest of your pregnancy, I am intimately involved in your care. And so I'm my chart messaging you back and forth, more so than with a regular prenatal visit where I'm seeing multiple different people and you may not see me for a couple of sessions, visits. This way I'm seeing your labs, messaging you, kind of following up on things that we talked about last session. So I think the continuity gives you more personalized individual care by your provider.
About how many people are there in a group?
Some people may risk out or more need, more individual thing, but we usually kind of keep it 16 to 18 on average. Currently at UCSD, we have a group of 6 moms and no partners right now for the first session, and their due dates are around November, December, and so that group is really bonding well.
You mentioned that some women might risk out of centering pregnancy. What does that mean? How do I know if I'm low risk enough to be able to do it?
The criteria for the centering pregnancy program involves just having a singleton pregnancy, so one baby, relatively normal pregnancy, straightforward, no high-risk pregnancy, and your provider will go over that with you at your new OB visit and kind of let you know that you're a good candidate. The patients who are participating in centering at this time at UCSD are all COVID vaccinated. So that's can be rest assured, like maybe a benefit for you knowing that everybody that you're in this group with has also been vaccinated.
Does having something like gestational diabetes or chronic hypertension or a history of a C-section, do those things require that I do individualized prenatal care instead?
That is a really good question, and no, that does not prevent you from doing centering pregnancy. So in the instance of gestational diabetes, you will meet with our diabetes and pregnancy program directors and submit your sugars, and we'll go over them at your individual 3 to 5 minute session and follow up on the back end. Previous C-sections, you are eligible for vaginal delivery if you so choose. And if you wanted a repeat C-section, you could still come to centering. For chronic hypertension, we would co-manage you with a physician, but that would just be a couple of visits in addition to your centering program visits.
Oh, that's nice. So I guess what I'm hearing is that you will let me know if there's the need for me to have kind of a higher level of individualized medical care.
Yeah.
I can still do centering pregnancy and still get that additional care as needed.
Yes, and all that support. And so if you need additional testing, something comes up, on an ultrasound, and you need additional something, we can always we'll be the primary prenatal care, and then any additional things we'll just do and supplement as needed.
If I am a mom who is pregnant at age 35 or above, I know that makes me advanced maternal age. Does that mean that I can't get my care, by a midwife? Do I need to see a physician? And how would that be handled?
I would say majority of my patients are advanced maternal age. Geriatric, it's my least favorite term. So yes, that doesn't preclude you from having midwifery care or centering pregnancy care. It just means you may need an extra ultrasound or two and some antenatal testing as you get further into your pregnancy, but still having centering pregnancy as your base prenatal care.
And for women that are doing centering pregnancy, can you tell us about who are the facilitators running the programs and running the visits, and what do they do? What's their background?
So right now at UCSD, the midwifery group is spearheading the centering pregnancy program, and finally got it here, yay! And so your sessions will be led by two co-facilitators. One will be a certified nurse midwife and the other will be a medical assistant. And we will equally kind of share responsibility of the centering group. You get your care as a provider from the nurse midwife. And nurse midwives, we have 14 here at UCSD currently. We are all advanced practice nurses who specialize in midwifery and normal pregnancy.
I know that during the sessions you mentioned that they will be done by both the certified nurse midwife and then working with a co-facilitator, a medical assistant.
Yes.
What is that medical assistant's role? And does it differ from individualized medical assistant, role for individualized care?
So when you go to a regular visit at, a 15-minute regular OB visit, you will have a medical assistant who will check you in, who will record your vital signs and kind of do that, make sure your pharmacy hasn't changed and things like that. And then your provider will see you and do your tummy check and listen to the baby and ask any medical questions. So that's the same throughout the centering pregnancy. So the medical assistant will be inputting the vital signs that you are recording yourself into your chart, into your electronic chart, and the midwife will be doing your visit, listening to fetal heart tones and fundal heights. But as for the group and the education of the session, we will both be doing that part.
What would I do as a patient if I was in a centering pregnancy group, but I needed to see my midwife either in between sessions or if I missed a session? Could I still see her?
Yes, so of course life happens and illness and vacations and things like that. And so the other benefit to centering is that you will have your prenatal visits scheduled out all the way through the rest of your pregnancy, dates and times, and that won't change. So you'll know when your next visits are and can kind of plan accordingly and whatever. But if you do miss or are unable to attend a centering visit, you can schedule a 15-minute visit with your primary midwife, the centering midwife, or another midwife if they're not available. Or I would of course make time for my centering patients, but yeah, you can get it in.
What type of patient do you think benefits the most from centering pregnancy?
I think anyone could benefit from centering pregnancy. I worked previously at the Navy doing it and there were a lot of dependent patients who didn't have any family nearby and their partners were deployed, and so it's a really great support system. It's great for people who have had kids before, and so just to collaborate with other moms who are in the same boat. It's great for people who just want to have a sense of community, and it's a wonderful place to meet people who have the same literally experiences kind of you're going through at this moment in your life.
It does strike me, especially with all the isolation so many of us experienced during COVID, that childbirth is a time where women coming together has been historically so important as part of feeling supported and empowered during pregnancy.
Yeah.
How long has this model of centering pregnancy been around?
For years. I'm not 100% on exactly how long it's been. I know it's been at least 10 years, maybe even 20. It's wonderful. And it does foster that sense of community. And a lot of people are kind of displaced from their family who Midwest, East Coast, and they don't have their core nuclear family here. And this is kind of a nice way to substitute and supplement that.
What are some of the things that patients worry about before joining centering pregnancy, or what are some of the misconceptions about centering pregnancy that you've heard?
I think that they're going to be maybe forced to participate, or that it's going to be kind of like feel awkward and put on the spot. And it's very organic, and it's actually really a lot of fun. And almost everybody kind of communicates after and have made a little network within.
Is the same provider involved for all of the sessions? And then how does giving birth work? Is it typically with the same provider? Tell us about that.
That's a good question. Yes, it's continuity, so it'll be the same group. And so around the first and second sessions, we may keep adding more people, or people may decide that it's not working for them, or scheduling events. But then after about the third session on, and there are 10 to 12 sessions for the rest of the pregnancy, including the postpartum reunion. And it'll be the same midwife, it'll be the same medical assistant, and the same core group every single time. So you'll meet every month just as you would in your pregnancy regular prenatal visits. And then as you get further into your third trimester, they meet more like twice a month. And as for who, it's wonderful if I, get to catch babies of my personal centering groups because we've definitely bonded, but it's not always work out that way. So whomever is on when you go into labor is who will catch your baby.
And where do patients typically deliver?
Jacobs Medical Center. And so the midwifery patients who are eligible and desire to can deliver in the birth center. And then if you don't want to do the birth center and you would like your epidural on admission, you can have the midwives and your regular provider on labor and delivery.
So you get that choice still,
yes.
Either way.
Mm-hmm. It's just like birth your way. However you want it to go, we're here to help support you.
That's great. And then how does the postpartum visit work?
The postpartum, it's very nice as people obviously deliver whenever babies are ready to come. And so sometimes patients will come with their babies to a visit where most people are still pregnant, and then they can talk about their experience and how it went. And then the postpartum reunion visit, pre-COVID, was a big potluck, and we would all eat and celebrate with all the babies. And that's around 6 to 8 weeks after the due dates. And then it's fun. We put the babies in a little circle with their heads and then take pictures, and it's just great. Everybody's just, talking about how everything went, and then they make mommy groups with each other and kind of do play dates and things like that.
I imagine that breastfeeding support is
huge,
facilitated by this type of model.
Yes. It's just support all around. So it's lactation support, birth support, and education. We do, make sure that everybody's doing well and the babies are feeding, and any questions and things like that. Tips and tricks for breastfeeding are always shared at the postpartum visit.
Is there anything that I would miss out on by not doing individualized prenatal care?
Waiting in the waiting room. I don't know. I really think
When would I check my emails?
I know, right? Or not have a kid on you if you have other children. You're like, this is my alone time. Yes, I think it's nothing but benefit if it works for your personality and your schedule. It's a great thing all around. And even people who are kind of more introverted or reserved and not so, extroverted, it's still a benefit. You don't have to participate completely to get the benefits. So you can just be more quiet and participate at your comfort level.
Vanessa, thank you so much for taking the time to tell us about centering in pregnancy today. It really sounds like an important step that UC San Diego Health is taking towards supporting women in a way that is actually very innate. That community of women coming together to support each other through their pregnancy with the guidance of a skilled certified nurse midwife and the support of UC San Diego Health's medical system. It sounds like a real opportunity. Thanks so much for your time today.
It was my pleasure being here talking about centering pregnancy. I love it, love centering pregnancy, and I wish everybody could participate in it.